about LaserMe,
Mm?
and we are going to speak about LaserMe. We are going to speak also the protocols that Nauvia can offer us, a special Hydro Deluxe with LaserMe. So there is a word that is bioregenerative process in the skin, and this means that we can treat the skin in all levels, from the deep level to the superficial level. And for this, and when we do this type of treatments, we can have long-term results. So we can get natural results and also short and long-term results. So my name is Diogo. I'm a dermatologist. I'm from Portugal. I have 3 clinics in Portugal, one in Sintra, if you know, one in Lisbon, and one in Algarve, in the south of Portugal. We are focused in dermatology, in plastic surgery, in vascular surgery, and also aesthetical medicine. I am chief of the department of dermatology in Cascais CUF Hospital, and I have an MBA in healthcare management, and this helps me a lot doing the business part also of the clinics. So I'm here to share experience, and if you have any questions, of course, we are here to discuss. We are going to present around 50 minutes presentation, and after we have 30 minutes to discuss between each of us. So the bioregenerative concept is treating the skin in a multi-level combination. We have to start always to treat the skin in the deep part and after go to the superficial part. So we start to treat the dermal layer, and after we are going to reach the dermal epidermal junction. This in the multi-level technique, and we should combine always hyaluronic acid with energy-based devices. And in this case, we are going to combine Hydro Deluxe and LaserMe. So when we combine technologies, so when we do combination treatments, we have a short-term and a long-term natural result in our patients. And first of all, we can use Zafiro, as we know, is an infrared technology that is going to produce a lot of collagen. Zafiro is an infrared technology that is going to activate the fibroblasts and is going to increase the production of collagen, elastin, and our own hyaluronic acid. After, we need to do support. And normal, when we want to do support and structural support, we think about stimulate. Stimulate is a product with a hyaluronic acid, Ka, calcium hydroxyapatite, and amino acids. These amino acids are proline and glycine. They are very important to activate the physiological function of the skin in the dermal layer and epidermal layer, and also is going to decrease the edema after the injections of the hyaluronic acid. So when we apply, and this hyaluronic acid is what we get. We don't need to put or to apply a lot of product. After we have the laser that is going to activate the epidermal-dermal junction. It's very important because our skin is divided in 3 main layers: epidermis, dermis, and hypodermis. And if we activate all the 3 layers, we have better results. So if you think about Zafiro, Zafiro is going to activate the dermal layer. But if you think about LaserMe, LaserMe is going to activate the dermal epidermal junction, so more superficial. So we have combination of two technologies that can activate the deep dermis and the superficial skin. After, we can think about Hydrodeluxe. Hydrodeluxe is a product very famous now in the world that can hydrate the skin. So we should apply Hydrodeluxe in the more superficial layers. So, and after, we can also use the cosmetic C-Shot serum and ceramide shield, normal in combination. C-Shot is 30% of ethyl ascorbic acid, and ceramide shield cream is composed by Centella asiatica and ceramide 1 and 6. And this is very good to protect the skin to external factors. So, conclusion about this. When we are talking about skin bioregenerative treatments and process, we have to think about multi-level technique. We should apply stimulate first in the hypodermis, after do Zafiro to activate the dermal layer, after apply Hydrodeluxe in a more superficial layer, and after do the LaserMe. And this we can do always in the same session. That's why we can get this bioregenerative process and in the multi-level technique. So, to do combinations, we have these two main products. We have Hydrodeluxe, which is the only one in the market that has hyaluronic acid linear, so non-cross-linked, and KH, calcium hydroxyapatite. We know that KH is going to activate the fibroblast for more collagen production. This Hydrodeluxe has 18 milligrams of hyaluronic acid, is a non-cross-linked, and has amino acids, this proline and glycine. These amino acids, again, they are very important for the biophysiological functions of the skin. So, if we apply Hydrodeluxe in the dermis or in the superficial dermis, we have more hydrated skin. So we can apply Hydrodeluxe in a monotherapy, for example, once a month, to hydrate the skin, to give glow of the skin, to give more quality of the skin. But also we can apply in the superficial dermal layer, and we call it subepidermal layer. When we have papule, we need to find papule. And this, we are in the right position of Hydrodeluxe. So Hydrodeluxe is a linear hyaluronic acid with calcium hydroxyapatite and amino acids, and they are very important to hydrate the skin. After we have Stimulate. Stimulate is the only cross-linked hyaluronic acid with calcium hydroxyapatite together in the same syringe, and is the only one in the market. Has concentration of hyaluronic acid of 26 milligrams, and also has the calcium hydroxyapatite and the amino acids. The amino acids are very important in the products, not only to keep the rheological properties of the hyaluronic acid stable, but also to activate the skin and to give us very interesting biophysiological function of the skin. And in this case, we should apply Stimulate in the hypodermis or near the bone. So the Stimulate we can apply, for example, in mandible, in zygomatic, in malar, for example, to give support of the skin. After we have the energy-based devices, and when we speak about Zafiro, we are speaking about dermal layer, activation of the fibroblast for more collagen production. So where we have fibroblasts, we have in the deep dermis and in the superficial dermis. That's why we can To activate the deep dermis, we can use Zafiro. To activate the superficial dermis, we can use LaserMe. So Zafiro is a combination of hydrosfoliation, thermal lifting, and infrared technology. And infrared technology is very interesting to activate the fibroblasts and is very interesting for indications as saggity and laxity and quality of the skin. Apart from LaserMe and different, LaserMe is going to have action in the superficial layer of the skin. So LaserMe has action in the superficial dermis, in the dermal epidermal junction, and also in the epidermis. So we have better photoaging results. We have better scar results. We have also improved the skin texture, stretch marks, and also quality of the skin. And one of the most important features of LaserMe is there is almost zero downtime and the efficacy and safety is very high level. Apart from that, we have the cosmeceuticals. And these cosmeceuticals, when we speak, we have the C-shot, very famous, 30% of ethyl ascorbic acid. Ethyl ascorbic acid is the most stable vitamin C in the market. Is going to brighten the skin, has antioxidative properties, is going to increase the skin quality, and is going to decrease the pigmentations. This is the vitamin C serum. This vitamin C is very tolerable to skin sensitivity skin. So patients that has a risk rosacea or a very sensitive skin, normally they can use C-shot with any problem. After we have ceramide shield cream, and ceramide shield cream is going to protect the skin for the external factors and also is a very interesting recovery cream. And in my patients, normally we do combinations, we do hyaluronic acid, we do energy-based devices, always in the same session. And after, normally all my patients, they go home with C-shot and ceramide shield cream together. Of course, we can apply C-shot once a day, for example, and ceramide shield also 1 or 2 times a day. But normally the C-shot we apply in the morning and night, first the serum, the C-shot, and after the ceramide shield cream. Normally, when we do cosmetics in our patients, we should always think about serum first and after cream. And here we can use the C-shot first and after the ceramide shields once or twice a day. And always with sunscreen, always 15. So, again, we are going to talk about LaserMe and Hydro Deluxe. We can do combinations, first the Hydro Deluxe after the LaserMe. We can do first the Hydro Deluxe after LaserMe and in the end Hydro Deluxe again, and I can explain you. Or we can do just Hydro Deluxe in monotherapy or just LaserMe monotherapy. So we have here 4 protocols. Hydro Deluxe alone, once a month, for example, in 3 months. We can do LaserMe alone, once in 3 weeks or 4 weeks, 3 times, 4 times, 4 sessions. We can do Hydro Deluxe first and after LaserMe, and we can do 3 sessions, 4 sessions, and also we can do Hydro Deluxe, LaserMe, and in the end Hydro Deluxe. And normally this is my protocol. Hydro Deluxe has 2 syringes in the box. So I use normally Hydro Deluxe in cannula to hydrate the skin. After I apply LaserMe to activate that superficial dermis, the dermal epidermal junction, and also activates the epidermis. And in the end, I apply with needle hydrodeluxe in the subepidermal layer. And this we have a sandwich technique in the superficial part of the skin. With this, we have better skin quality, better skin texture, better skin scars results, and also satisfaction in the patients. So, how LaserMe acts in my practice? When we're talking about scars, and we have two LaserMe in the clinic too, and we are going to reach now the third LaserMe in our clinics. LaserMe is very interesting for scars, not only acne scars, but also surgical scars. And normally we have very good results in these patients. Of course, that's why we use so much LaserMe. First of all, they have very fast results, is very safety to perform, and there is very fast recovery time. Nowadays, our patients, they want fast results, and our patients want zero downtime. They want zero recovery time. And they come to the clinic, and after 1 hour, 2 hours, they want to go to work, they want to go to social activities and everything. So in this case, we should think about a non-ablative laser. And LaserMe is a non-ablative laser, fractional, and resurfacing laser. So what this means? We have three main groups of lasers. We have ablative, we have subablative, and we have non-ablative. This means that ablative is going to create columns of ablation and is going to destroy the epidermal layer. We have the subablative lasers that they are going to produce also ablative columns, subablative, so ablative columns, but they don't destroy the stratum corneum of the epidermis. So they will pass the first part of the epidermis and they do the ablation in the deep skin. After we have non-ablative lasers that they don't create ablative columns, but they create coagulation columns. So they are going to produce heat, thermal injury. And this thermal injury can, first of all, activate the fibroblasts and also activate the dermal epidermal junction. It's very important when we are doing a laser, especially with LaserMe, we need to think about three main cells. First, fibroblasts that exist in the dermal layer, and also two cells, the melanocyte and the keratinocyte. And these two cells are present in the epidermal layer. So the LaserMe is going to activate the fibroblasts in the dermal layer, but is going to differentiate the keratinocytes in the epidermal layer, and also is going to modulate the melanocyte in the epidermal layer. That's why LaserMe can be used to acne scars, dilated pores, melasma, and skin quality. So for melanocytes, we are modulating the melanocyte, so we are decreasing the activation of the melanocyte, and we have good results and interesting results in melasma patients. Is going to differentiate the keratinocytes, producing keratin 1 and 10 in the epidermal layer, and is very important for the skin quality and skin texture, and also is going to modulate the melanocyte that is very also productive in melasma patients. And all these treatments, there is almost no downtime. There is fast recovery. The patient became a bit red during the treatment, and after in 3-4 hours, this erythema disappear. Of course, that after a laser, the skin becomes dry. And after all lasers, the skin in the beginning of the first 3 days, the skin becomes a bit irritative. It's normal. We are creating thermal injury in the skin. And of course, our skin got a trauma. And this becomes, the skin turns a bit irritative and scaly. This is completely normal after the laser. That's why we should apply the ceramide shield ceramide shield cream always after the lasers, because it's going to become this discomfort of the patient with less time, and of course the patients will feel more comfortable. But if we do ablative laser comparing to a non-ablative laser, of course, we have better results and fast recovery results after a non-ablative laser. Of course, ablative laser normally the recovery time is around 10-15 days. In a non-ablative laser, this could be 24 hours, for example. So why I like LaserMe in my practice? Why? Because it's a non-ablative, fast recovery, efficacy with no downtime, and my patients, they can return to social and professional activities right away after the session. So this LaserMe is a FDA approval laser, is a 1470 nanometers fractional non-ablative laser for skin resurfacing. It's going to increase the collagen production and is going to increase and improve the skin quality, and is one of my first choice in my practice for scars, not only acne scars, but also surgical scars. Stretch marks is with interesting results. We know that stretch marks is difficult to treat. We need a lot of sessions, and with LaserMe, we have good results, and also we have very good results in texture, in skin texture. And I want to repeat, with almost zero downtime. So why I choose this LaserMe in my practice? We can do almost in all patients that come to our consultation, from 15, 16 years old, with adolescents and people with active acne, we can use it. In scars, acne scars, in dilated pores, in surgical scars, if you are plastic surgeons, if you are dermatologists, and even aesthetical medicine doctors, almost we have in our consultations scars, surgical scars, body scars, stretch marks, dilated pores. We want to improve skin quality of the patients. So almost all our patients have indication for LaserMe, almost. Second is a very fast laser. We don't need so much time to understand about this technology. This technology has a very interesting software, very fast learning. When I acquired LaserMe, the laser came and I was doing already, they came in the morning and I was doing already in the afternoon treatments without any problem to understand and to learn. There is no learning wave long term as comparing to the other lasers. And the indications really for LaserMe is scars, dilated pores, melasma, wrinkles, surgical scars, and improved skin quality. And also we have interesting results in tattoos, and I'm going to explain you how. And also we have improvement and good results in burns, which is very interesting. Also, I do in my practice for hair growth. So when you're talking about LaserMe, we are talking about the epidermal junction for skin resurfacing. We know that we have three chromophores: hemoglobin, melanin, and water, and LaserMe is going to be absorbed by water. And the peak of this laser is 1470. So there is a high level of water absorption. So if the chromophore is water, much higher is hydrated our skin, better will be the result for LaserMe. So LaserMe wants water. So if we apply linear hyaluronic acid before LaserMe, the penetration, the results, the distribution of the energy from LaserMe is higher. That's why we should always apply Hydrodeluxe first, and after we do the session of LaserMe. And I do this in almost all my patients, from acne scars, dilated pores, skin quality, when I want to increase the collagen production, wrinkles, skin quality, everything. So always Hydrodeluxe first and after LaserMe, always. And LaserMe is very practical. Why? We have always LaserMe, the power will send 2 watts from energy, but we just need to control the fluence. When the fluence is lower than 30, and after I'm going to explain, we are trying to treat the superficial skin. When the fluence is higher than 30, so we are treating more the deep structures. Just this that we need to control. After, we have the spot size, as you see here. The spot size is this square, and we can create low coagulation columns in the left square, or we can create a lot of columns of coagulation. So we have the laser is going to emit the laser beam and is going to create columns of coagulation in the skin. These columns could be in the high number or could be in the less number, and we'll decide according to the patient's skin. If the patient has sensitivity skin and the patient has more prone for rosacea, so we are going to choose less columns of coagulation. If the patient doesn't have skin sensitive, if the patient doesn't have risk of rosacea, we are going to increase these coagulation columns in the skin. So we can choose the spacing between the columns of coagulation between 0.8 millimeters or 4 millimeters between each column of coagulation. That's why we can do more aggressive treatments when we choose more coagulation columns, or we can decrease the coagulation columns and don't be so aggressive to our skin. After the fluence, we can choose from 5 millijoule per coagulation columns, or we can choose between 5 to 50. So if you want to be less aggressive and more superficial, we are going to use still 30, the fluence still 30. If you want to be more aggressive and more deep to the skin, we are going to use more than 30 in the fluence. And this I'm going to explain in the laser afterwards. After we have, for the beginners, we have the basic mode. We just need to choose the phototype of the patient and what we are going to treat, if it's skin quality, wrinkles, scars, stretch marks, for example, and the laser is going to choose the parameters immediately. Or if you want to be, if you are not beginner doctors with the laser, we can apply and choose the advanced mode, which we have, and we can choose the fluence that we are going to use in the skin. So why is so interesting this laser? The laser beam is in the maniple. So when we are using the LaserMe, we need to be perpendicular to the skin. And the laser beam is inside of the maniple, so is more close to the skin. And in this case, we have a higher precision result and is very safety, because the laser just is working when it's in contact with the skin. Apart from that, we don't need to use glasses, and the patient also, they don't need to use glasses, sorry. Why? Because the laser is going to act just when it's in contact of the skin. So, LaserMe is very safe, has a very high level of efficacy. Here, there is a lot of scientific evidence. There is not painful. There is very high level of patient comfort. It's a very fast treatment, normally 10 minutes, sometimes 5 minutes, maximum 15 minutes per session. And the cost efficient result is very interesting. Apart from that, LaserMe is not going to destroy and do ablation of the skin. It's going to do coagulation of the skin. And after 10 days, we have the full recovery epidermal regeneration. So normal, the downtown is almost zero, and our skin turns to normal activity after 10 days of the treatment, after the treatment. Comparing to other lasers of the market, this will be longer. So there is a damage in the dermal epidermal junction in the day zero, in the day of the laser. And after 10 days, there is the full complete regeneration of the skin. And with this, we have collagen production, and we have a fractional column in the dermal layer. Apart from that, we can use also in melasma patients, as I told you, because it's going to modulate the melanocyte and is not going to increase the activation of the melanocyte. So in melasma patients, for example, we can use the LaserMe, and after we can recommend some dyspigmentation or C-shot, for example, serum, and we have good results. How we do in melasma? Because we don't want to activate so much the melanocyte, we want just to modulate the melanocyte. Which parameters we are going to use? We know that melanocyte is in a superficial dermis, so we cannot go with the fluence more than 30, should be less than 30 always. And also the coagulation columns should be not so much, but not so minimal. We have to be in the middle size, so around 2 spacing, and we can do 1 or 2 passage. Of course, that the number of passage depends of the skin quality of our patients. So we can do 1 passage, 2 passage, or 3 passage, for example. When we should stop, when is the end point of this laser? Is when we see erythema and edema. So when we see edema, a bit of swelling, and red skin, erythema, we should stop, do the laser, okay, in the session. This is our endpoint. The endpoint means that if you do another passage, when we see the endpoint, we have a risk of some complications, as burning, for example, or scarring, or a bit of fibrosis. So this laser is a very safe laser, 100%, but we just need to check how is the endpoint. If you do a passage in the skin of our patient and we see edema and erythema, so we should stop. The patient will need just 1 passage. But if we do 1 passage in all skin, all facial skin, and we don't see erythema and edema, we can go for the second passage. And if we don't see erythema and edema, we can go to the third passage. So that's how we should control. And normally in the full face, I use around 100, 150 shots per patient. This doctor, our colleague, Dr. Kubik, one of our friends, he did tests and a scientific article about the efficacy and the safety of LaserMe in acne scars. And he saw that after one session, we can see good results in the depth of the acne scars and also in the diameter of acne scars, which is very interesting. So after one treatment, we have a good result in the diameter of acne scars, and after 3 sessions, we have a very good result. After one session, we have a good result in the depth of acne scars, and after 90 days, we have a very good result. In acne scars, we have to be more aggressive, so the fluence should be higher than 30, because we want to reach the superficial and the deep layers of the skin, so we need to put the fluence higher than 30. And also the coagulation column should be higher, because we want to be more aggressive. So if you have a patient with acne scars, for example, in the mid-face, we should do always in all face around 30 fluence, and after inside or on top of the acne scars, we should do more passage with fluence higher than 30. Do you have any questions till now? Or we'll do in the end of the session? We'll do in the end of the session. So my top indications of LaserMe, and I'm in love with LaserMe, I'm in love, is dilated pores. Remember, if we have a patient with dilated pores, think about LaserMe. To improve skin quality, think about LaserMe. Scars, not just acne scars, but also surgical scars, think about LaserMe. Burns, and also synergistic protocols with no fillers and no devices, always. And remember that LaserMe has very good results in skin quality and is a fast recovery laser results. First of all, is non-invasive. Second, very fast to perform and very fast results. The software is very intuitive. The laser is very compact, is portable. We can transport the laser between our clinic, and also we can transport the laser between other clinics if we have. Is a very smart handpiece. We have results after one session, and there is minimal consumables. Before and afters, this is just one session of LaserMe. If you see this patient, she has a bit of hyperpigmentations. She has a bit of, has wrinkles, and has a bit of rosacea, sensitivity skin. I did just one session of LaserMe, and if you see, the wrinkles got improved, the skin quality is better, the sensitivity skin and the rosacea also get better, and the patient is happy. Of course, this patient will need more sessions, not only LaserMe, but also stimulate to give support to the mid-face, for example, and after Hydrodeluxe to hydrate the skin. In this patient is a very she has very indication for a bio-regenerative protocol. Stimulate, Zafiro, Hydrodeluxe, and LaserMe. But we did just in this patient one session of LaserMe with very interesting results. After this patient, also one session of LaserMe. If you see, better skin quality, better that improve the dilated pores, also the hyperpigmentation, superficial hyperpigmentations, also the wrinkles around the mouth, the perioral wrinkles, and also the wrinkles around the peri or in the periorbicular region with very good and interesting results. And this is just one session of LaserMe. After we have for acne scars, if you see this patient that did 2 treatments with interval of 30 days. So in the day 0 and in the day 30. And if you see, this colleague from Brazil, she did in the first session 28 from fluence, and in the second session she increased to 40. So in this case, we are treating the superficial skin in the first session, and in the second session we are trying to reach more the deep skin. As I told you, we are going to control just the fluence of the laser. So we can go from 5 to 50. In this case, she chose 28 in the first session and 40 in the second session. This is important. Why? We are treating different levels of the skin, and we are going to be more strong in the second session. So she did probably a full face treatment with 28 of fluence in all face, but after she did some passage in the acne scars. So we can do full face first, and after we do the second and the third passage in the acne scars. And in this case, if you see, very good results after 2 sessions. Very good. Of course, this patient will need more sessions. So how we do this? This colleague did in the day 0 and in the day 30, but we can do 3 weeks apart, or we can do even 2 weeks apart. When we have acne scars, we can do sessions 2 in 2 weeks, every 2 in 2 weeks, or every 3 or 4 in 4 weeks. But if you want to increase the skin quality and the wrinkles, we are going to do the sessions every 4 in 4 weeks. Why? Because we need time for our collagen production, yes, or 6 in 6 weeks. But always think that if you do a multi-level technique, so Hydro first and the laser second, the results from the LaserMe will be even better. So our choice in this case, this is amazing result with LaserMe, but I know that if the doctor will apply Hydro before the LaserMe, the result is going to be even better. So we can do in monotherapy, but also we can do in combination treatment. This is before and after from Kubik, from our colleague, also with a very good results. Remember, the parameters, he chose 30. Why? Because he wants to, the patient has a bit of sensitivity skin, is young, so we are going to use 30 in fluence. And the spacing should be close. So there is a lot of coagulation columns, and should be, he used the spacing of 1 millimeter between each coagulation points. So this is a good parameter in this case, and with a very good results after 3 sessions. We have here as well acne scars with also improvement. If you see, after 3 sessions, again, the parameters in 30 fluence and the spacing, he used 1.4. He did 2 passage, and we have good result and interesting result. After we have here acne scars again, so when it's not just my opinion, this is opinion in all over the world. All doctors that is using LaserMe, they love to do in acne scars and surgical scars. And if you see, the parameters used here was used in the first session 35, and in the second session 38. So we need to have action in the dermal epidermal layer and also in the dermal layer. So we need to increase more than 30. If you want to have activation in the epidermal layer, so we are going to use less than 30 the fluence. In this case, acne scars, good results also after 5 sessions. If you see, this patient has atrophic scars, They are also a bit of hypertrophic scars. And this patient received 5 sessions of LaserMe. And if you see, the doctor start with 30 fluence, after increase to the second session to 35, after 38, after 39 and 39. So the doctor increased the fluence in every session. And the spacing, he decreased also the spacing. So in the first session was a more light treatment. In the last session was a strong treatment. Of course, that the patient needs to be used to the laser, and we don't know how the patient will react to the laser. So we should and advise always try to choose more light parameters in the first session and increase the parameters as long as the sessions goes. Here, surgical scar with a very good result. This scar, a bit erythematous scar. If you see, after 3 sessions, the patient got a good result. So, was done 3 in 3 weeks. Every 3 in 3 weeks was done 1 session. The parameters used was 29 because it's in the face. We don't want to be so aggressive. The spacing was done as 1 millimeter between the coagulation columns and was done to passage. And if you see here, interesting and very good results. Again, scar in the perioral region, not easy. 3 sessions as well, to passage, the parameters 28 and the spacing 1 millimeters between each coagulation column with good results. Scars again, and here in the neck. So was used 35 in this case of fluence, after in the second session 36, and after in the third session 40. And after 3 treatments, we have also a very interesting result. Here, a scar in the eyebrow, also with a good result. Here, pigmentation, hyperpigmentation, inflammatory hyperpigmentation. So the laser is going to modulate the melanocyte, and we have also a good result. In this case, we cannot go with the fluence very high, so maximum 30, and the spacing should be higher than the scars. So the colleague used 1.5. Again, inflammatory hyperpigmentation with good results. Again, not the fluence, not higher than 30, and the spacing around 1.5. Again, to passage. And if you see here, very good, interesting results. Again, inflammatory hyperpigmentation in the knee. Good in the leg. Good was done 26 the fluence, which is nice. And the spacing was around 1.5, in this case 1.2, and the doctor did 3 passage with a very good result after 3 treatments. Here, I will advise you to do every month, so 1 session per month. Here, stretch marks, which is not easy, good result. So, was done every 3 weeks, the session. The parameters was used was 35, so the stretch marks we need is like scars, so we need to be stronger. The spacing we decrease for 1, and we do 2 passage. So very interesting result. And acne scars, but hyperpigmented acne scars, also with good result after 3 sessions. You see, this case is very interesting, very interesting. For melasma, a colleague from Brazil. Remember, Brazil is a country which there is a lot of sun damage. So if you choose ablative laser, we are going to create hyperpigmentation after the laser, post-inflammatory hyperpigmentation. In this case, we should always use non-ablative lasers. Why? Because the recovery time is higher and we don't have so risk of hyperpigmentation. And if you see, a good result after 3 sessions. Again, the melasma, we don't want to activate the melanocyte, So we need to use fluence lower than 30, and the spacing will be around 1.5 to 2 millimeters. Again, melasma, good result with LaserMe. So if you can see, LaserMe is not just for skin quality, not just for skin texture, not just to combine with fillers and UV fillers, because UV fillers, as we know, they are thermostable. And if they are thermostable, we can do energy-based devices after the application of the filler. But LaserMe has very good results in dilated pores, in scars, in surgical scars, and in stretch marks, and also in hyperpigmentations, melasma, burns. As you can see, this is one of the best results that I saw. This is a burn, and it's amazing. So was done LaserMe, and around 4 to 5 sessions in this case, and the parameters was used was 35, and the spacing around 1.5. So the doctor chose 1.7, did 3 passage, and we see a very good result. So why? Because there is a very high level of collagen production. If you see, it's amazing, this result. Also some skin lesions. So we have good results after some sessions. In lips and around lips, the perioral area with good results. So this was just one treatment, and the patient got very interesting results. So we can use around the oral activity, the oral area, but also around the periorbicular area. And we can do combination. We can do lip filler. This was used intense lips, and also the laser. Why not? And with interesting result. If you see, the wrinkles got improved, and also the volumization of the lip was done. Very natural results, and very interesting, this one. And of course is also a protocol that we can offer to our patients, the perioral zone. And in this case, we can use the intense lip to apply. After, we can do the LaserMe to increase collagen, and after we can apply Hydra Deluxe to do hydration of the skin. And in tattoos, of course, we have the options of picoseconds and nanoseconds lasers, case switch, of course. So in tattoos, we advise to do a laser of case switch first and second, but after, for the tattoo shading, for the tattoo shade, we can do LaserMe after the third or fourth session, and we have very good results when we combine lasers. So we should do pico or nano, and after in the first, second session, and in the third, fourth session, fifth session, we can add the LaserMe in the tattoos, and we have also interesting results as this one. So when you combine Hydra Deluxe with LaserMe, we have even better results. So as higher is the hydration in our skin, better will be the result of any energy-based devices. So if we apply Hydra Deluxe and after we do LaserMe, the result, the penetration, distribution, and uniformization of the energy from the laser will be better in the skin. So that's why, in this case, we can see a good result after just one session of Hydra Deluxe and LaserMe. If you see better skin quality, better improve the wrinkles, better skin texture, and also the wrinkles got improved. This was just one session. Imagine if this patient will do 3-4 sessions and also will apply stimulant. Apart from that, this was just after 30 days. After 30 days. This is one of my favorite results. This was just one session of Hydra Deluxe with LaserMe. If you see, this patient got much better fresh look. This patient is old. As much older is the patient, more difficult is to see results. And this patient got an amazing result, not only near the eyes, but the mouth is more smiley. And this was just one session of LaserMe and with Hydrodelex. Apart from that, our colleague, Disapong from Thailand, he did Hydrodelex and LaserMe, of course, with the good results, always in the same in the first session, Hydrodelex, and in the second session, LaserMe. So when we are doing combination Hydrodelex with LaserMe, we can do or in the same session or in different sessions. Or we do in the same session, Hydrodelex first and after LaserMe, or we do Hydrodelex first in the day 0, and in the day 7, we do the LaserMe. So we can do in the same session or in different sessions, but always 1 week apart. In my opinion, I think that we should do in the same session, because if we do in the same session, we have more water content in our skin and better will be the result of LaserMe. And without any complications, without very safety, and also with very interesting results. If you see here, very good result after the session of Hydrodelex and LaserMe. Wrinkles, also our colleague from Italy, Marini, good result. Hydrodelex and 3 sessions of LaserMe, and we see a very good improvement in the wrinkles result. And hair. As we know, this laser is going to do coagulation columns in the skin. And if there's coagulation columns, we also can activate the hair follicle. In this case, we cannot go with the fluence very high. Normally, I use 5 to 10 the fluence in each session, and I do 1 session every month, or 2 in 2 months. This can create a bit of drug delivery system in the scalp, and when we combine with minoxidil, topical minoxidil, or PRP, the absorption of PRP and the minoxidil will be better. So we can use LaserMe safety in the hair, in the scalp, for hair growth. We can do a lot of protocols. In the clinic, we have Zafiro. So we do always hydrosfoliation to exfoliate the scaly part of the skin. We do LaserMe. We do PRP or minoxidil topical, and in the end, we finish with hydrosfoliation from Zafiro. But you can do any protocol that you can find, and LaserMe has a very good option also in the hair growth. So in this case, you always need to use fluence, a low fluence. We don't want to destroy the hair follicle. We want to activate the hair follicle. And in this case, I advise to do with low fluence, till 5, 10 millijoules per point. Why? Because I don't want to destroy the hair follicle. And in this case, we can do 1 session every month or 1 session 2 in 2 months to increase the permeability of the topicals and also to activate the hair follicle. If you see, very good result after 3 months. I think that we can see a good result. And also after 6 months with a very good result. Of course, that normally the hair patients, they should also take oral medication as finasteride, dutasteride, and now oral minoxidil, but also they should do some local treatments and topical treatments. And of course, LaserMe off-label, this is between us, should also increase the hair growth and improve the hair quality. As you see, with good results. Of course, the patient will need more LaserMe. Of course, the patient will need oral medication and topical medication, but LaserMe, always when I treat hair, I do topical, I do treatment, and I advise oral medication. Another protocol, intense lips, to give, as we spoke already before, intense lips to give volumization, LaserMe, and Hydrodelex. So intense lips is going to give volume and structure in the lip. LaserMe is going to increase collagen production in the lip and around the lip, and hydrolysis is going to hydrate. And this is a very nice protocol to our patients. In this case, the doctor, she did the Novia in the lips, LaserMe in the full face, and Hydrodeluxe in the full face. And this, in the same session, got a very good anti-aging effect and a very good natural looking. As you see in the first before and after, we see better skin quality. We also have improve of the lip volumization and structure, and also better skin quality and decrease the sensitivity of the skin. Better rosacea. The patient has a bit of rosacea-like skin and got also improved. So to finish and conclude, why I like LaserMe. LaserMe is a non-ablative laser. We don't have complications. We don't have risk of secondary hyperpigmentation. It's a very fast recovery laser. It's a non-invasive. It's very intuitive to learn. It's very compact. It's very easy to transport inside the clinic and between the clinics if we have more than one clinic. But inside the clinic is also important. When we have two patients in the same time and they are for LaserMe, we can transport in the clinic very easy. Has a touch sensor, is very safe. The patient, they don't need to use glasses, and we don't doctors to use glasses as well. The health profession doesn't need to use glasses because the laser just acts when it's in contact of the skin, so it's safe. And we have very good results after one session without any problem. Apart from that, we can use in all phototypes. We can use from phototype 1 to 6. It's incredible. We don't need to be afraid about complications with this laser. We don't need. We just need to check the endpoint. If the endpoint, and if you reach the endpoint, we should stop the session. So the endpoint is always erythema and edema. And if you see this, we should stop to do. So some patients, they need just one passage, another patients 2 or 3 passage. And there is a lot of satisfaction. I have a lot of patients asking for LaserMe in our clinics. About business model, I'm going just to show is, of course, depends of each country. So if we have our price, if you ask for 200, 250, 300 euros per session, and if the patient will do 3 sessions per year, we have a very good return business model. We are going to receive, of course, 900 euros per patient. Of course, that we can do 1 patient per week. I think there is no problem. If you have patients to increase skin quality, dilated pores, scars, acne scars, skin quality, wrinkles, we can use LaserMe, and we can advise LaserMe, of course. And if you do 1 patient per week in 1 year, we get 40,000 euros. And this is interesting because sometimes patients, they want full face. Sometimes patients, they just want perioral or periorbicular. Sometimes patients, they want small areas like a neck. Sometimes patients, they just want some surgical scars in the body. And normally we can ask for 150 euros in these small sessions. So per year, we can get 64,000 just if you have 1 patient per week. The problem here is we don't have 1 patient per week. We have much more than 1 patient per week. Maybe we can get 5 patients per day for this laser. So the business model is also with good, interesting numbers. So I think that we finish.
1 hour, exactly 1 hour. Correct.
It's not
thank
easy
you, dear
because,
doctor,
yes,
for sharing
Natalia,
your experience.
It's not easy because I'm speaking with the computer with no feedback. But I would like now your feedback, and we have half an hour to discuss about the results, about the efficacy, about if someone has some questions, and we are here to answer and to help.
Yes, we have some questions from our participants. The first one, can also be used on the hands for dark spots.
Dark spots. Dark spots. So dark spots, we have two main types. We have lentigos or we have melasma, hyperpigmentation. We have to know that lentigo is more superficial, and LaserMe is going to modulate the melanocyte. So if it's going to modulate the melanocyte, if it's lentigo, I prefer personally to use IPL. But if it's melasma or hyperpigmentation, I use LaserMe. Always in hands, we should do the sandwich effect, so the combination. We should apply Hydra Deluxe first and after LaserMe. Of course, because dark spots could be different, yes? If it's lentigos, so we have the K-switch, Pico, or HiPL. Of course, that the LaserMe also has good improvement in the dark spots, if it's lentigos, but not so good as a HiPL. HiPL is the first choice. But if you have melasma, if you have hyperpigmentation, if you have burns, so if this pigmentation is coming from burns or from melasma or for post-inflammatory, yes, pigmentation, so for sure the first choice will be LaserMe. So we have to diagnose well what is these dark spots, if they are lentigos or if it's melasma or hyperpigmentation. So
Thank you.
Sorry, if it's hyperpigmentation from melasma for post-inflammatory hyperpigmentation, so we are going to do LaserMe. We can hydrate the skin first with Hydra Deluxe, but with LaserMe, we go with low parameters. We cannot go with the fluence very high. We have to be low because we don't want to activate the melanocyte. We want to modulate the melanocytes. After, I want just 10 minutes to show also here the parameters, but after the questions, maybe it's going to be more easy as well.
Yes, we have as well one more question. At what stage of surgical scar healing can treatment be started?
So of course that this is an interesting question, because there is some doctors that they tell, okay, do the laser just when you take out the stitches, and there is some scientific articles that is telling, okay, wait 2-3 months and after start. In my opinion, I start after 1 month when the stitches goes out, so when we take out the stitches, and as fast as you do, better is the result. When you are speaking about scars, normally the sessions should be between every 2 or every 3 in 3 weeks. We need to be more aggressive. We have to increase the fluence. We have to decrease the coagulation distance points. And with that, we have better results. Yes. So I think 2 to 4 weeks after the stitches goes out, we take out the stitches, we can start to perform the treatments. Apart from that, also, we can combine, and we should do Hydra Deluxe and LaserMe in the scars. Yes, surgical scars. We have a very good doctor and our colleague from Italy that did amazing result with just Hydra Deluxe monotherapy. Hydra Deluxe, Hydra Deluxe, Hydra Deluxe, every month, 1 session per month, with a very good, interesting result. Why? Hydra Deluxe is a linear hyaluronic acid with calcium hydroxyapatite and has the amino acids. So this is important for hydration, for stimulation of collagen, and amino acids for the biophysiological function of the scar. Because scar is a problem of remodeling collagen. So if you do Hydra Deluxe and LaserMe, even better. If you don't want to do Hydra Deluxe in the scar, we do LaserMe alone with also very interesting results. But always high fluence, because we want to go deep, and the coagulation column should be smaller because we want to be more aggressive. As I told you, if you have a rosacea patient, we have to decrease the fluence and increase the coagulation columns, yes, of the laser beam. But if you have scars, we have fibrotic tissue, so we have to increase the fluence and decrease the coagulation distance.
Thank you, dear doctor. And one more question.
Yes, me, please.
Dr. Eldar. Yes.
Yeah, I have two questions. The first one is about the LaserMe. Is it unique for medical doctors, or cosmeticians and other professionals are allowed legally to operate the machine?
Do you want me to answer? Of course, that this is a laser, so should be a doctor to use it. Of course, that the laser is so easy to perform. Probably we could delegate to our nurse to do it, but I don't do that. I think that the laser should be, as a legal ethics and the legal reasons, should be always done by a doctor, and a credentialed doctor, of course. I don't know, each country has its rules, but of course, Nauvia wants...
I'm practicing.
Sorry.
I'm practicing in Israel. And if there is a representative of the company from Israel, I would like to hear it from him. What is the regulation in Israel for this machine? This is first.
But of course, is a laser and is FDA laser. Of course, a laser has always complications. In this case of LaserMe, is a very easy laser to perform, and
yes,
I don't see
this is my impression.
Yes.
I must say that your presentation was very convincing about trying to use it, and it's quite how can I say it, gives me a nice variety of situations that I can see how can I use it. Now about
Eldar, just to comment that. When I got LaserMe, and this was like 3-4 years ago, I was thinking that LaserMe is going just to improve skin quality. Yes, I never imagined, never in my life, that I'll get very good results in burn and in scars and everything. Is now interesting after 2-3 years, because I think that I was the first one in Europe, I think, but I'm not sure. After 2-3 years, all the colleagues in the world that has LaserMe, they speak about scars and burns with LaserMe. It's interesting. And sometimes they have also Pico, they have K-switch, they have nanoseconds lasers. But it's interesting how the world, the doctors that has LaserMe all over the world, they speak about LaserMe always very happy and satisfied, always. LaserMe is something that, in my opinion, is a surprise. Because first of all, is a very safe laser, but second, we can be very creative and we can create very good and creative protocols. And for me, it's a surprise. LaserMe gets so well results. I think that the important thing from LaserMe is the laser beam is in a maniple, so is more near to the skin. And apart from that, the LaserMe is going to create perpendicular columns, exactly perpendicular in the skin. So we have here the laser. I'm going to try to, sorry to interrupt you, but I think that
Diogo, please stop sharing the screen, and we will see you on full screen.
Okay.
Yeah.
Let me check.
Just stop sharing.
Can you see me?
Yeah, we can see you and your presentation, but just stop sharing. Oh, yeah, and now we will see you better. Perfect.
So this is...
Oh, so this is now it's amazing.
My draw, this was a draw, is a Portuguese beach. I tried to be original. So the laser is this, yes? And the laser, we have this, yes? First of all, and sorry, after I would like to know your question, yes? But I think this is important. The laser is very light, you see? We can transport this. Second, I hope this is okay. The laser is inside the maniple. So if we have a laser inside the maniple, we are more near to the skin. Apart from that, the laser has a sensor touch. If it has a sensor touch, it's going to work just when it's perpendicular to the skin. So this makes that the columns of coagulation will be precise and safety. We are not going to do we are going to do this and in the skin. So it's going to be a touch effect. And with that, we have a precise column of coagulation in the skin. That's why I think the results is what we can see, good results, because it's very precise. And this was very intelligent from Nauvia to make, I think, to make a laser beam inside the maniple, not there, inside. This is the laser.
Okay. And it's less difficult because of the optic. Usually the optics of the lasers make a lot of problems in maintenance, this I know from other companies.
Yes. Yes.
So the next question is much more simple, is about the Hydro Deluxe. What is the recommended way of using it? Papules, cannula, other way?
You can do how you want. That's why we can be creative. Normally, what I do always is with cannula first, after laser, and in the end, papules in needle with Hydro Deluxe. So like this in the session, but this is a very complete session, yes? It's Hydro Deluxe with cannula to hydrate the skin. After we do the LaserMe, and
How
end,
long? You do this in the same session?
Same session normally. So you do with cannula, we do LaserMe, you calm down the skin, 20 minutes, 30 minutes, yes, with a mask, and after we do with the needle. This is a complete session.
So you put two Hydro Deluxe on one face with the laser in between.
Yes, this is a complete. This is my protocol, but we can do different protocols. Yes.
And for how long? For how many times you repeat it?
You can repeat you can do one session in younger patients, 6 in 6 months, or you can do in the older patients. You can do every month 3 sessions, for example, and after 6 in 6 months. The only thing here, the Hydro Deluxe, if you apply with cannula, you are in different levels. So you are hydrating the skin in the deep, because cannula goes to the superficial hypodermis, yes? And after you do the laser, that is going to do columns of coagulation in the epidermis and dermal layer, and in the end, you finish the hydration in the superficial dermis. So you are applying 2 Hydro Deluxes, but in different levels of the skin. Apart from that, remember that it has calcium hydroxyapatite. So it's going to activate the fibroblasts, but it's going also to improve the epidermal layer, because epidermal layer is also good to improve. So that's why I apply Hydro Deluxe in the 2-level techniques. But you can do just laser alone every month, for example, 1 session every month. You can do LaserMe and Hydro Deluxe with papule. You can do in the day 0 Hydro Deluxe with papule, and 7 days after LaserMe. You can do Hydro Deluxe with cannula in the first session, and after 7 days you can do LaserMe. But I think in the same session is better. Is more time consumable for us, yes, less time, yes. The patient comes just 1 time. And second, also, I see better results if we do always in the same session. Because if the chromophore is water, we need to have water in the skin, yes? So better, if you apply Hydro Deluxe first, the absorption of the laser will be even better. So I prefer to do always in the same session, always. The protocols depends of the indications. If it's just to increase the skin glow and skin quality, once 3 in 3 months is more than enough. But if you want to improve wrinkles, if there is fibrotic tissue as acne scars, if there is older patients that they have a lot of sun damage and dehydrated skin, they are not hydrated skin, so you can do 1 session, 3 sessions, so 1 session per month, 3 sessions, and after 3 in 3 months, for example. But it's important to understand that we can do as a preventive approach or we can do as a therapeutical approach. And this is important. Is a patient that is young, 30 years old, we can do, for example, and we do a lot in the clinic, we do hydrodeluxe, all face, LaserMe, 1-2 passage, and after a bit of toxin. In the same session, of course, I need to wait a bit, 20, 30 minutes to calm down with the mask. And after I apply toxin, this is a good 6 months a patient comes and has glow skin, hydrated skin, and also the effect of toxin, botulinic toxin. But after, in the older patients, we'll need to be more aggressive. And these you can do hydrodeluxe, LaserMe, and filler, for example, Novia. So, and these we can think about the bio-regenerative process which stimulate LaserMe and hydrodeluxe. So that's why I like Novia a lot, because we have the safety protocols, but we can do also our creative protocols, which are safer, the same. They are safe. Yes, you can do your own protocol without any problem. This protocol, I'm sure that will be safe. That's why I like this brand. And okay. I would like you as well to do your own protocol, and next time you share with us. And I'm sure that is going to be safe.
Please send me your email or phone number. I promise to visit you.
Yes, come to Lisbon. Now I am in Algarve, in the south of Portugal, but come.
Yeah, Algarve is an amazing.
Yes, I know for sure, that your protocol will be safe and efficacy. I'm sure, but always think, if you want to do a combination of hydrodeluxe and LaserMe, it's better to start with cannula, because you cannot do needle and after pass LaserMe above the needle points, you know. So
I understand that I have to go from the deep to the superficial.
Always deep to superficial. And if you have LaserMe,
this is obvious.
Yeah, obvious. And if you have LaserMe, you can do this. But if you have also Zafiro more deep with stimulate, and LaserMe more superficial with hydrodeluxe. It's just this. And this is the protocol that I most do in my clinical practice, believe me. And I don't have any complication. I don't have any patient that is not satisfied. I don't have it. And believe we have here some we have here some comments, but I don't understand this language.
Thank you very much.
Thank you for your comment. It's good.
I just want to say something in Hebrew. דוקטור אלדר, מה שלומך? מדברת אל נורה, אני הסמנכ"לית של נוביה, ואני אדאג להעביר לך גם את הפרטי התקשרות שלו, וגם את כל הוובינר ואת כל מה שתרצה.
Okay.
I just told them in
Sounds
Hebrew.
nice. Dr. Diogo, we have one more question.
אני לא שומעת אותך, סע לשתק.
Dr. Diogo, from what age can we start the LaserMe procedure, especially for treating post-acne?
I do after 15 years old.
After 15 years.
Yes.
I will translate. 15 лет можно начинать. Okay.
Is a non-ablative laser. So, and the effect of the laser is local. So you can, when you see acne scars, you can start immediately. And as soon as you treat, better is the result. So you can do after 15, after sometimes 14, of course, we can combine with peelings, for example, peeling in a day 0, day 30, LaserMe, for example. But of course, you can start after 15. I don't see any problem. Of course, 18 will be the best recommendation age, but 15 you can do with safety also procedure, with safety profile.
How is it possible that LaserMe can be used during summertime as well?
Because it's a non-ablative. If it's non-ablative, it's not going to destroy the epidermis. And if it doesn't destroy epidermis, you can use in summertime without any problem. The only thing you should advise your patients to be away from the sun, yes, in the first 5 days. but this is normal. Yes, they cannot go to the beach, they cannot go to the swimming pool, but you can do in the summertime, why not? You cannot you cannot do laser in the summertime if it's a ablative or a subablative mode, because this will be destroyed, the epidermis is going to be destroyed. So the skin is divided by epidermis, dermal, and subcutis. If we destroy the superficial part, we have, with the laser, we have more risk for hyperpigmentation. So if it's a non-ablative laser, we don't have destruction of the superficial layer, that is epidermis, you can do in all year. There is no any problem. The patient cannot go to the beach in the first 3-4 days, yes. They should use sunscreen, but sunscreen should be used all year. Also for LED light, also for driving, yes. That's why we have more pigmentations in the left, normally in the left side, because we are driving and we receive more. If you see, almost all of our patients, they have more pigmentations in the left hand and in the left side of the face.
Also, I have a question from Dr. Glauco Barbosa, but I don't speak that language. If you could unmute yourself and ask, nas zonas proximas aos labios, it's in Portuguese or what language?
I don't know.
Proximas aos labios, aos olhos. No, it's sounds.
That is not Portuguese for sure, what you are speaking. Maybe the doctor is Portuguese, but you are not speaking
Okay.
Portuguese.
And one more question in English. Does the laser destroy previously injected cross-linked HA? Does laser
What?
destroy
No,
cross-linked HA? No,
Yes.
it's no.
Wait.
Neither.
If it's Nauvia filler, no. Nauvia filler has this thermostability property. This is what I most like from Nauvia. If it's a thermostable, means that, maybe this is like this. If it's thermostable filler, so means that you can do the energy-based device after the injection of the filler, but this only if you use Nauvia filler. But if you use a cross-linked, not thermostable filler, of course, will destroy because it's heating. So we cannot heat the skin when we apply the filler, except if you inject Nauvia fillers, because they are thermostable. And this is scientifically proven, yes? This is not from my mouth, this is scientifically proven. And as we know, from Nauvia properties fillers have very high level of cohesivity, very good and interesting property of viscoelasticity. We don't need to apply so much. We have a very good projection. Normally I use 1-2 syringes per patient. I don't use more if it's just to give a bit of support. If of course it's to do mandible, if it's to do a chin, I use a bit more, but normally maximum 1-2 syringes and I do all face. But the most and the better property from Nauvia fillers is the thermostability. And the future, the present and the future of aesthetical medicine is for sure the combination. It's not just injectables, it's not just energy-based device alone, it's the combination to do this bio-regenerative process. And for sure, for that, we only have one choice. We have just Nauvia fillers. And this is from my heart. We need thermostable, yes? So if the laser destroyed the fillers, yes, if they are not thermostable. And thermostable you only find nowadays, in the present, in pegylated fillers. That is Nauvia fillers.
And one more very interesting question. For example, if patient has inflammatory acne in the active stage, can we perform a procedure, LaserMe procedure?
LaserMe, you can do, of course, it's not our first choice. Normally, if it has active acne, we'll think about oral medication, antibiotics, and this we can think about minoxidil, tetracycline, or isotretinoin. But if there is a small acne spots, active acne spots, I do LaserMe without any problem. So if it's a fibrotic, active, strong inflammatory reaction in acne patients. So better to do oral medication and after think about LaserMe when is after 6 months or after 8 months. But if it's a small acne spots and isolated, you can do LaserMe without any problem and with good results as well.
I will translate. Анна, вы можете работать, если есть единичные воспалительные элементы, тогда можно работать. Но если там в активной стадии очень повреждено лицо, то не нужно. Начинать нужно пролечить. Yeah, and Hydrodeluxe and LaserMe in one procedure. Can we do LaserMe and Hydrodeluxe in one procedure? Yes, doctor has just answered that yes, you could do, especially when you use cannula. So
yes,
we have more.
you can do, and I advise to do it. I advise to do it. Do the combination. Believe me that when you do just laser alone, you have amazing results. But if you do a combination protocol, you have even better results. So yes, do always Hydrodeluxe with LaserMe. Believe me, it's better to do 1 session of Hydrodeluxe and LaserMe than to do 3 sessions of a laser. It's amazing, the results. And I do this protocol already for a long time.
Thank you. And one more, now in English, thank you. In the areas near the lips and the eyes, is there no danger? Can it be performed on the lips?
Yes. Yes, of course, it's not dangerous. Of course, that in that area, we have the laser beam, yes? And the laser beam, we can choose if you want to do full beam or half beam or just 10%. We can choose in the machine, in the software. So when it's near the oral cavity, yes, I choose 50% normally of the laser beam, and you can do without any problem around the mouth and around the eyes, of course. But always you need to touch, for example, in the eyes, be careful, yes? You need always to touch the bone, yes? In the bone. Never pass the bone area. You need to touch the bone. So you need to touch the orbicular bone, yes?
Thank you.
I can try to...
To show parameters, right?
Yes.
Perfect.
So it's so easy that I can show like this, you see? But you cannot see the screen, yes?
Yeah, now it's, I mean, I see like white screen. I don't see, yeah,
yes,
probably of light.
It's going to be difficult.
Oh, I can't see.
Unfortunately. But there
Now
is
it's,
no problem.
I could see something, but it's not good.
I'm going to show you just one thing, yes? So switch on the laser. We have, if we do in basic mode for the beginners, but look, it's beginners, but I always use basic mode almost. It's for practical. We can choose the phototype. So my phototype is 3. So I'm going to choose 3. I'm going to choose the area. We can choose body or face. And I'm going to choose body. Yes. And I'm going to choose skin texture. So we have 3 things to choose: phototype, if it's face or body area, and what is the indication. And we have acne scars, we have scars, we have skin texture, we have stretch marks, and we have wrinkles. And I'm going to choose skin texture. I apply start. The software is going to show already the parameters that we're going to use. I don't need to think. And I just click on. This is 10 seconds software. So, look, I'm going to do the laser now. It's done. So the laser, you see, I don't use glasses because the laser beam just work when I'm in contact with the skin. If you see I'm in contact with the skin, I press the button and it's working. But if I do this, it's not working. You see? So it's so safe, the laser. I'm touching the bottom of the laser and it's not working. I'm going to put in the skin, I touch the bottom and works. You see? So I don't need to use glasses and the patient also doesn't need glasses. Sometimes in our clinical practice, we are looking for the glasses. We don't find, sometimes it's true. What is the glasses? In which which place? Fast also to intuitive software. You don't need to buy this laser and after go to a training, I don't know where, wait for the training. You can buy the laser and in that day you can start to do. It's so intuitive. Second, as I told to Eldar, is the laser is in the maniple. And this, because the energy from the laser is next to the skin. And we have a precise column of coagulation effect in the skin. Of course, that if I do hands, for example, I'm going to press again. So I'm going to put on. When I start to do, I don't feel pain. I don't feel pain. When I see, now it's not, I need to, you see, just when it's perpendicular. Yes? I start to see edema and erythema. So it's a bit swollen, a bit and red, so I should stop. If I stop, I don't have burn, I don't have side effects. It's just this. We can do in the face, in the neck, in the hands, décolleté, scars, abdominal part, stretch marks, dilated pores. You can use to every patient. I don't see any problem with this laser.
Thank you. And one more question. If we buy the device...
Now no wrinkles in the hand.
No. If we buy the device, are we required to purchase materials periodically? And can we use other materials on it? Okay, doctor, please.
Natalia, I didn't understand the question. So if
are we required to purchase materials? I mean, I think it's like disposables, or what should we buy extra if we buy the device? So maybe we need some extra materials to work with device.
so you are talking about another energy-based devices?
No, it's about, for example, disposables. What kind of disposables do you need to do a procedure?
Nothing.
Nothing.
Just
We need
if you
just to
want-
change applicator after 50.
Yes.
Okay.
Yes.
Yeah.
The life of the maniple is 50,000 shots.
Yes.
What it means? If I do 100 shots per patient, so I can do 500 patients with this. Yes? So 500 patients, they are a lot of patients. We do a lot in our clinic. We are already in the 4 maniple. Yes? So we did more than 2,000 patients, yes, with the LaserMe. But this is what you have to change. You change maybe 3 in 3 years, 4 in 4 years, maybe the maniple, if you do once per week. The only thing is you're not going to use 1 patient per week with LaserMe. You are going to use every day 5 patients. All patients, they need better skin quality. So why not to offer to our patients LaserMe treatments? Why? They need. Apart from that, sometimes we think about EMLA, topical anesthesia. You don't need to apply topical anesthesia with LaserMe. LaserMe is not painful, so you don't need to apply topical anesthesia. Apart from that, what do we need to more? Just some bandage to clean the face, some micellar water, and also a recovery cream. So is what you need. You need something to clean. You can do the laser and after some cream to recover, but after we have the C-shot, we have the ceramide shield cream for the patient to go home and to do for 3-4 weeks and come back after to the second session.
Good.
So it's just this that you need. It's easy.
And one more question. What do you use to clean and sterilize the applicator?
Ad applicator, just
To sterilize, I mean,
micellar water and some alcohol, but not so much, yes? Not so big concentrate. just a bit, because this is easy to clean, yes? A bit of chlorhexidine, a bit just, but not so much, yes. And water. This is it.
And it's like one more question. For example, if patient applies local retinoids, can we
Yes.
we can do a procedure? Okay, good. That's
Yes.
no more questions.
Yes, retinol. Of course, that retinol is what? Vitamin A. So we should stop retinol application 3-4 days after the any energy-based device procedure, and LaserMe is also included. So if the patient is taking topical retinol, you stop 3 days before. And it activates. After, recover cream, sunscreen cream for 1 week after the laser, and after 1 week, you can return to the retinol. Of course, retinol, acid glycolic, tranexamic acid, salicylic acid, they are good to do also in combination with LaserMe. So if you are talking about some cosmetical creams, before the laser, 1 to 3 days before the session, I advise to stop and to return to the cosmeceutical routine after 1 week. And meanwhile, before the session and after the session, just sunscreen and recovery cream.
Okay, yeah, it's clear. Анна, I will switch to Russian. Анна, просто нужно сделать перерыв, то есть он имеет в виду топические ретиноиды при нанесении, то есть за 3 дня до процедуры нужно сделать перерыв, и потом через неделю после восстановления он может вернуться к использованию топических ретиноидов. Вот. Thank you so much, doctor. I don't see any questions, so I hope.
Natalia, I don't know how many people are in the webinar.
Now 34.
Okay. So LaserMe, I don't know, for people that they don't know LaserMe, LaserMe is one platform that is very interesting. First of all, the business point of view is amazing. Second, the safety of the protocols are amazing. Third one, we can do protocols and we can be creative in protocols. So it's a non-ablative fractional laser. So there is no complications. We can do in all phototypes. We can do all over the year. We cannot be afraid about complications and side effects. So for sure, I advised for all my colleagues, yes, this platform, believe me, is from the heart. Is an easy laser and to intuitive laser. We can transport in this clinic is important when we have 3-4 consultations treatment rooms, and you have 4 patients in the same time. And also we can transport between the clinics. But the 5th point is very safe treatments. And we have for a lot of combinations, a lot of indications. Yes, remember patients with acne scars, acne scars, dilated pores, skin quality, skin texture, surgical scars, stretch marks, increase collagen. So think about LaserMe. It's easy platform, and also with very good efficiency levels results.
Thank you so much. Okay, so I think it was very clear message that LaserMe should be in every clinic because it's very easy to work and we'll get really amazing results. And now I would like to tell that we have already ready protocols for you to work. You don't need to create anything. For example, Dr. Diogo shared his experience and he already advised how many shots to do, at what parameters. So it's really easy to start to work with LaserMe. So join our Nuvia community and have a nice day ahead. So yes. I will send the recordings to all our partners and they will share with you, dear doctors, later. Okay.
Yes, and if you want to come to Portugal, you are welcome, of course, for a training, for example. And if you have any questions in Instagram, I have Diogo Forjaz. You can find and you can ask any questions there.
Thank you very much.
Thank you so much. Have a nice day.
Yes.
Bye. I hope that I helped.
Bye.